Are you or somebody you love suffering from sadness and just feel a little bit overwhelmed by life right now? Are you wondering if you're suffering from depression? Well, please stay tuned. We have a doctor in the house, and depression is our topic today. Hi, I'm Shelley Quinn, and we're very glad that you're joining us today on Issues and Answers. If you know anyone who is feeling an overwhelming sense of sadness or perhaps just a lack of motivation, call them and tell them to tune in today, because our topic today is depression. And this will surprise you because our guest shared this statistic with me. Over 18 million people in the United States alone are suffering from depression. Now, I know the figure varies for many different countries. Don't know what it's like in the country from which you're watching, but the point is that depression is something that is a very prevalent and real condition, and we're going to discuss that today with our special guest. Let me introduce you to her, and it is Dr. Cynthia Powell Hicks. Dr. Cynthia Powell, we're so glad that you're here with us today.
Thank you for having me. I always enjoy coming and speaking to people about the effects of depression.
Well, first, let's get a little bit of history on you. You have a PhD. Explain to us your credentials.
Thanks for asking. I'm a psychologist, and I have a doctorate degree in clinical psychology. Also, I spent additional time working with the special topics with children. I'm a child psychologist by trade. I spent additional time working with children, and then I did a subspecialty working with abused children that have been neglected and physically and sexually abused and emotionally abused. But depression reaches all sectors. You know that. Age and race and creed.
It's no respecter of persons. That's for certain.
That's for sure.
I know that your life work. There must be times that when you listen to things that are going on and you witness things that are happening in people's life, there must be times that even as a Christian, it's difficult to shake it off and turn it over to the Lord, because that would be enough to make you sad in your own life to hear some of these things.
It really can affect you. I can only equate the first month that I worked on the unit that worked with children that had been molested by their actual parents. And I'll be dating myself yet again, back in those days they had a tape recorder that you would dictate your notes in. So for the first 30 days, as I was driving home, I was sobbing while dictating the notes, because I would have like a 30-minute period, and then I would take it in for the stenographer to transpose the notes. But it can be, so I had to really come to terms with it and ask the Lord, if this is the ministry you really want me to have, then you're going to have to not take away the empathy or sympathy, but give me the strength to be able to endure.
Amen. And to recognize what you can change and what you have to turn over to the Lord.
That's
so
right.
that you have to sometimes compartment, even in ministry, and this is a sad admission, but you have to compartmentalize your work and the things that you hear, and you have to pray and be able to release it, roll that burden over on the Lord, and kind of to keep your own sanity, you have to compartmentalize and be able to change hats, I guess is a good word to say.
That's an accurate way of explaining it, because when you go into a particular setting, say like the hospital or the clinic, or you're going to go and give a presentation, you're not really sure what you're going to walk into.
Yeah, that's true.
Yeah, and as being a Christian, I can share this story. This is one of the second month I was an intern. I walked into a room, and you'll ask the patient, well, how are you feeling? And they'll say, obviously, okay. And then after you start asking more and more questions, then you know in which direction you're going to go. So I did a DAP, which is draw a person. I asked this patient to draw a person when he finished, he had a little demon on his shoulder with a little pitchfork. And so you can only imagine what I was thinking. So I then started inquiring and asking more and more about it. And so he was speaking more and more like disassociative and speaking more of what this demon was telling him to do. So being my first time ever seeing a psychotic patient, I assumed, because I was, a Christian and had been, in the church forever, that he was demon possessed. And so I ran out of the room and went straight to my therapist, to my supervising therapist, and said, "I'm not going back in that room. I can't go back in there. They're demon possessed. I'm not a pastor." So that's just a little.
So the Lord had to
really
really
work
show
with, yes.
you that psychoses and various mental illnesses really have
nothing.
I shouldn't say never have
Yes,
anything to do with demon possession, but it's a rare thing because they are chemical imbalances and problems. Well, for our audience, our topic today is depression. How would you define depression?
Well, what I want to really explain to everyone is that sadness and disappointment is a normal way of life. It happens to all of us, and it can occur because we've lost a job, or because we're having financial issues, or just we're upset. And when that sadness, which is so normal, and disappointment that occurs persists over periods of time, and then we're having different thought processes where we're either we've lost interest in getting out of bed, or wanting to go to work, or interacting with other people, or our self-image. We're starting to feel bad about ourselves. We're looking in the mirror and just only looking at the negative sides, not looking at the cup being half full. We're always looking at the cup being half empty. And if we have major extremes, as in sleep patterns, or in eating, or in our weight, or in our sexual behavior, major activities either increasing or decreasing, or if we're starting to feel hopeless and helpless and feeling like there's nothing that can make us feel better. And then the more severe part of the depressed moment would be when people would want to end their lives, to end the pain, and start, or possibly do self-mutilation, which seems to be on the rise at this time.
Very much so, particularly among young people.
That's what I was going to say, and these are definitely signs of clinical depression. However, if you only have one or two, don't be alarmed and run out and say, "Oh my goodness, they told me today I'm clinically depressed and I must do something," because, like I'm saying, it's the severity of it, it's the intensity, the consistency of it.
So is it accurate to say that depression can be situational? Let's say that you have lost a mate. I know when my uncle died, my precious aunt, who is such a go-getter, she's such an active and up person, and she's suffered some great things in her life, but she's always bounced back. And she told me, she continued on with her life, but she said that it took her nearly a year to get her feet under her and another year to walk without wobbling. So it may have been a situational depression as you're going through the grieving process, this sadness, this loneliness. But if depression is something or the sadness, the loneliness, the lack of motivation is extended for a long period of time, it can go into where it's affecting the brain chemistry, right?
Sure.
And then you become chronically depressed, and they call it, what is that, a clinical depression at that point?
Clinical depression, or can go into major depression. And I'm glad that you brought up the issue of when you lose a loved one, especially couples that have been married for years, and people that are depending upon each other, and that's their support. That's their person, their go-to person that they go to when they need to talk to someone, like in the middle of the night, or if they just want to share something they've heard or seen, or if they're having issues. What does that person do, during that time? So they have that void, they have that vacuum, and if they don't fill it with something, then it can go into a far serious levels of depression. And clinically, we really look at it 6 months up to 2 years that a person can really go through that process after they've lost a loved one.
Yes. Yeah. Now, what about people who, I have a friend whose daughter most recently went through, she was very active at church. She held down a full-time position with a government office. She's got grown children, but suddenly there was a change in her behavior, and she wanted to sleep all the time. She started having a lot of headaches. They went through various studies, medical studies, to see if there was a physiological reason. But she got to the point that over a period, you could just see how she was on this downhill slide for over a year, and then for about 2 years, she got into such a serious depression that medication didn't help. They tried even shock treatments, didn't help. They've done many things. Now, praise God, now she has come back up. It's like the pendulum has swung the other way, and she's doing much better. What is the physiological happenings in the brain? What's happening when a person gets depressed? What actually causes depression? Some people can suffer the loss of a job and not get depressed. They may be sad. Some people, it can be just the factor that trips them up.
There's so many different levels and reasons for the depression, but definitely chemical imbalances, hormonal imbalances. Definitely before anyone should really go and they should have a physical, a complete physical, before they actually say for sure they're totally clinically depressed. And most therapists and psychiatrists will recommend that, because if you have a thyroid condition, I mean, you could be sitting in the emergency room and they're getting ready to hospitalize you. I have seen it before, and they're just overlooking something so simple. Just look at the labs, look at the levels, look at the imbalances that can be in the brain, as you had said before, or that could just be hormonal imbalances. There are a lot of us pre-golden girls, or even golden girls, which I had to bring up, that just hormonal, something so simple,
Right.
You just look at the labs, just look at the levels, and there are medications that aren't even psychotropic medications or anti-anxiety medications. They're just regular medications that your OBGYN or your family practitioner or your endocrinologist could prescribe for you.
I'm one, and we've had this discussion because I recently had a thyroid condition myself, and for a period of months, I didn't feel depressed. I wasn't sad. I was still very active. But the joy, the motivation, I mean, my life is so overscheduled and overcommitted that I'm constantly going from one thing to another, and I was still in motion. But what happened was I had a tendency to wait till the very last second to do something because I didn't have the joy of preparation that I used to have. And when I was talking with my doctor, I said, I don't think I'm depressed, but for some reason, my motivation is down. And it turned out that my thyroid was we just caught it before it completely crashed. Great. So there's things that happen in our bodies that can affect this, and I'm glad you brought out that people need to have that serious physical exam before you start taking the other drugs that are available.
Definitely. And I'm not wanting to be an alarmist, but I think that you really need to know yourself. You need to know your body. And like you were the first to say, before someone could say, gee, something's looking, you're looking pretty sad, you're looking pretty, dysthymic or melancholy, that you knew something was changed. You didn't really know what it was, but your affect, your mood was so different.
Yeah. And I want to, for some reason, I feel impressed to say this right now. We're handling this kind of on a superficial level, but I feel like right now there's somebody that's watching who may think that you're beyond hope and that it's something that you feel like life is hopeless and you're ready to take your life. Please listen to the rest of this program, because my mother tried to commit suicide several times, and she'd gotten to that point of feeling hopeless. And the interesting thing is, there's so many times when there's an intervention in suicide, that the person who is considering taking their life, if you can intervene, that within 24 hours, that thought's gone from their head and they will never try it again. Now, when we get to that level of being suicidal, if someone is speaking of suicide, someone is thinking of suicide, what do we do?
What I would recommend is get them intervention immediately. Take them to the hospital, take them to a doctor so that someone can actually talk to them further to see if it's a suicidal idea or a suicidal ideation, or if they've had a suicidal attempt. Because some people may say, oh, I'm not feeling well today, I just would like to die. Then someone else may say, I have these bottle of pills, or I'm going into the kitchen, I'm going to, I don't want to give suggestions or ideas, but, that they might want to end their lives that way. Or someone may say, here's my wrist, I've already tried this and this, or, how come I woke up, I took this bottle of pills. So you definitely would like someone, a health professional, mental health professional, to be able to intervene with that. And what we also need to know is, because we have to go outside of our comfort zone, like speaking to our pastor or our family or friends, it doesn't mean that we're less of a Christian or that our walk with Christ is any less.
Oh, Cynthia, I'm so glad you said that, because what I have found is that many Christians feel guilty for being depressed.
Yes.
And, I also want to say this, that sometimes pastors are not really trained in handling that. And maybe your husband or your wife or your spouse or maybe a parent is telling you, snap out of it, you come out of this. You don't need to mope around all the time. And it's impossible for people to snap out of it if they're clinically depressed. So depression is not, it is not a mental condition so much as it is a physiological condition. It's an illness, is it not?
It's an illness just like hypertension, or like cancer, or like diabetes. It's just an illness that recently people are coming to terms with and seeing that there's no shame in having a mental disorder. Because if I told you I was hypertensive and my medication wasn't working, and I would ask you for advice, but if I had a mental illness, 9 times out of 10, I wouldn't tell you that, and I wouldn't share what type of medications I would take.
Yeah, because even you using the words like depression and mental illness and equating that, it's like, wait, are you trying to say that I'm mentally ill? Yeah. And it's, when you're mentally depressed, then what can we say? It is something that is affecting the mind, and often it is chemical. Now, for that very reason, I have interviewed a number of doctors who believe, Christian doctors, who are trying to do away with the idea and put to rest, I should say, the myth that it is wrong for a Christian to take an antidepressant. How do you feel about that? What role do antidepressants play in treatment?
I see it as a major stabilizer, because the one thing is, you don't want the patient to continue spiraling out of control. And if you're constantly feeling worthless, hopeless, and useless, the goal is to elevate you, to make you feel better, to make you feel as normal as you possibly can, and to keep you from wanting to harm yourself.
And is it not true? I remember Dr. Neil Nedley, many of our audience members will be familiar with that name. And he's written a book called Depression, The Way Out. And he says that when the serotonin level is so low that sometimes it's absolutely a necessity to put people on an antidepressant, which then helps this the production of serotonin, and then once you get them up to a normal level, now you can start treating them with cognitive behavioral therapy and whatever, the idea of positive thinking, but you can't reach them when they're that low. So you have to get them, as you said, stabilized, and then you can start even possibly weaning them off that medication, but it's not something that just happens by itself. Is that right?
You're absolutely right. And it's just like hormonal levels. And you can always test those, going to your physician also and having lab work done. But you're absolutely right with those levels, because if you can't get people up to the level that they need to be, then they're not going to be able to receive the additional type of treatment. Okay.
So what about what I'm hearing a lot of lately is people who are having anxiety attacks. How do anxiety attacks tie in with depression? can it lead to depression, or what is causing the anxiety
Well,
attack?
unfortunately, almost everything kind of leads to that level of depression. And it's anything that is excessive. But once again, go back to the hormones. Go back to your other levels of chemicals within your body to see. And also reduce the pressure and the stress in your life, because that can trigger anxiety. I tell women all the time wherever I go, hang up your Supergirl suit, you know.
Yeah,
I mean, we multitask all the time, all the time. Hang up that suit, because that can lead to anxiety, overwhelmingness. Just listening to your schedule that you're going to be doing within the next 24 hours would overwhelm some people, but you're able to balance it and handle it very well. I mean, you look very gracious, you know.
Very tired.
Yeah. But the average person might not be able to handle that, and then that would put them into an anxiety attack, and then they might start having some of the symptomatology, which would be the headaches, the clamminess in the hands, the dizziness, the just overwhelmingness, you know. Yeah.
So let's talk about, because we want to give you hope today. There's so many people that, you know, life can be overwhelming, and particularly with the economic downturn, it seems that we're seeing many more calls to 3ABN about issues of depression and people who are sad. Besides, number one, if there's someone in your family, you or a loved one, who are feeling this way, I talked with a lady the other day, praise the Lord, who had a suicidal thought, and she said as soon as she did, she just was impressed by the Lord to drive herself to the hospital, which doesn't always happen.
No.
But she went to the hospital, and within 48 hours, she had gone beyond that crisis. Now she's seeing a Christian psychologist.
Excellent.
And she's in treatment and doing much, much better. There are people who are chronically depressed, but we want to give you hope and some ideas. So first is seek intervention if it's serious, but we should seek professional help.
Definitely.
Talk with your doctor, get the medical exam. If you are diagnosed with clinical depression, what are some of the treatments other than taking anti-anxiety or antidepressant drugs?
If you're truly a major clinical depressed person, I would still recommend the medication.
Right, starting with that.
The medication, and then get in a support group.
Okay.
And then have a therapist. You can see a psychiatrist, social worker, psychologist, marriage, family, child counselor. They're more than capable of helping you with how to function and process within your day, because that's how we want to lift people up so that they can function and become productive citizens as they used to be, and have a normal pattern and normal activities. Also, get yourself involved with support groups, with church groups. I tell you, if you ever want to feel loved and and needed, go and tell someone, gee, I have free time, what can I do? Churches have different ministries.
Amen,
Yes,
amen.
yes.
And you know, I think that prayer, getting involved with people who will pray with you,
Definitely.
learning to turn your problems over to the Lord, learning to claim the promises of God. If you're going to, if you want to take those negative thoughts captive and make them obedient to the will of the Lord, if you get the promises of God in your heart and kind of to overcome your negative thought, get God's thoughts in your heart, and that can really be helpful, can it not?
And be careful who you associate with.
So what you're saying is, if you're feeling in a melancholy mood and you have a friend who is always down in the mouth and melancholy and negative, that can, attitudes are contagious, aren't they?
Oh, definitely, definitely. So find someone that's just the opposite, that's very positive and very active, if that's not going to, overwhelm you, definitely, if you aren't able to handle the schedule. But definitely be around uplifting people.
Let me ask you this question, because we just have a few more minutes, but are there certain people who are more prone to depression, and are there certain people who are more resistant to treatment? Because I do know when you're talking about going to therapy, I've talked with so many people who've been to a therapist and said, oh, it was just nearly life-changing for them. We have a friend who was having anxiety attacks, and it turned out that a project he was working on just the recent year, connected in his brain to something he had worked on like 15 years ago. That was it was a project where he saw a lot of trauma, where he stuffed it. He didn't get deprogrammed from the horrendous things he'd seen. And so now working on a similar project kind of opened up things from his past. But for men in particular, it seems that women are anxious to talk out their problems.
Yes.
But is it more difficult for a man to go and admit that he needs somebody to talk to?
Lots of times, because men are the head of the household, men are always in charge. Men feel that if they show that side of them, then everything will fall apart, and then people will think less of them a lot of the times, and especially when you're talking about mental illness. But if you just talk about regular health, more women visit the physician or therapist than men do. Lots of times you'll see men in the emergency room when they have to see you, versus than when they just want to do preventative things. But women will run to the physician quite a bit, just for prevention. So you're absolutely right. And you also mentioned, like, the trigger point for this particular person was something that he had suppressed for years and years. So that's why lots of times when you go for therapy, you go and you have regressive therapy, where they always say, tell me about your childhood. Because it's pretty cliche. You see it in almost every movie, and people are lying on the sofas. But it really tells you about the adult that you're seeing clinically in the office.
Are there more women depressed than men, or do we see any? I mean, as we said, it affects all nationalities. It affects all socioeconomic situations. But
the answer to that question is the reason that we see, at least this is my belief, that we see more women, as far as the CDC would say that there are more women that are clinically depressed, is because more of us are going to the doctors. So we're more, they're regulating us more, and so the doctors are reporting that there are more women at that time.
Cynthia, I cannot believe that our time is already gone, and I feel like we've just barely touched on this. You will come back and talk with us some more on this topic, will you not?
Of course.
Thank you so much, and thank you for being here. And I just admire you, the work that you've done in your life and continue to do, and I know it hasn't always been easy.
Thank you so much for having me.
Well, we're very blessed. Again, we just want to encourage you, if you are feeling overwhelmed, talk to a pastor, talk to a friend, go to your doctor, find out if you have a medical exam, check the thyroid, check out what's going on in your life. It could well be that life is just overwhelming you by problems, and this is a situational, temporary thing. But if you have been suffering a feeling of sadness or loss of motivation, or just feeling like you don't know if you can go on with life very long, you need help. And please reach out and get that help. And don't think that you can just pull yourself up by your bootstraps, but remember to pray. Turn that burden over to the Lord and ask Him to lead you to someone who can help you today. Thanks for joining us.